8 early warning signs of colon cancer you must not ignore. A cancer diagnosis is one of the scariest things that can happen to anyone. Sadly, cancer is a leading cause of death worldwide, claiming millions of lives each year. Among the many types of cancer, colon cancer stands out as a significant threat, affecting thousands of individuals annually. The good news is that early detection through regular screenings and a healthy lifestyle significantly increases the chances of successful treatment. That's why it's crucial to be aware of the early warning signs and symptoms of colon cancer. In today's video, we'll delve deep into 8 of these crucial warning signs that you should never ignore. Contrary to the misconception that it's an older person's disease, an alarming number of diagnoses are occurring in younger individuals in their 20s and 30s. Let's get started and empower you with the knowledge to protect your health. One of the most alarming signs of colon cancer is rectal bleeding. If you notice blood in your stool, don't ignore it. Consult your doctor immediately. Bright red blood suggests bleeding in the lower digestive tract. Dark maroon stools indicate bleeding higher up. Early detection is key. Get checked out by a medical professional immediately. It may be nothing, but it never hurts to seek professional help. Now let's talk about another change in bowel habits that might indicate colon cancer. A narrowing of the stool. If you've been experiencing persistent constipation or notice that your stools have become consistently thinner than usual, like a pencil or ribbon-like shape, it's essential to bring this up with your doctor. While occasional changes in bowel movements are normal, consistent narrowing could indicate a blockage in the colon, which might be caused by a tumor. Think of your colon like a garden hose. When it's functioning correctly, waste material flows through it smoothly. But if there's a blockage, like a kink in the hose, it restricts the flow, causing the water to come out in a narrow stream. A tumor can create a similar obstruction, leading to thinner stools. However, if you notice this change consistently over a prolonged period, it's crucial to seek medical advice. Your doctor can assess your symptoms, consider your medical history, and determine if further investigation is necessary. By being aware of these subtle signs and taking proactive steps to address them, you're taking control of your health and well-being. We've all experienced constipation at some point in our lives. While it's usually a temporary inconvenience caused by dietary factors like low fiber intake, dehydration, or lack of physical activity, persistent constipation can sometimes signal a more serious underlying issue, including colon cancer. When a tumor grows in the colon, it can partially or completely block the passage of stool, making it difficult to have a bowel movement. This blockage can lead to infrequent bowel movements, straining during defecation, and the feeling of incomplete evacuation. If you've been experiencing persistent constipation that lasts for several weeks or is accompanied by other symptoms like abdominal pain, bloating, or blood in the stool, it's crucial to consult your doctor. They can help determine the underlying cause of your constipation and recommend the appropriate treatment. Don't let embarrassment prevent you from seeking medical attention when you need it. Remember, early detection is key when it comes to colon cancer. So if you're experiencing persistent constipation, don't hesitate to reach out to your healthcare provider. Have you ever experienced the feeling of needing to go but not being able to, even after you've tried? This frustrating and often uncomfortable sensation is known as tenesmus, and it's a potential warning sign of colon cancer. Tenesmus occurs when a tumor in the rectum irritates the surrounding tissues, creating the feeling of needing to have a bowel movement even when the bowels are empty. It's like a false alarm from your digestive system, and it can be quite distressing. Now, tenesmus can also be caused by other conditions like irritable bowel syndrome, inflammatory bowel disease, or even a simple infection. However, if you're experiencing this symptom persistently, especially if it's accompanied by rectal bleeding, abdominal pain, or a change in bowel habits, it's crucial to consult your doctor to rule out any serious underlying causes. Don't ignore this symptom or try to tough it out. Your doctor can help determine the cause of your tenesmus and recommend the appropriate treatment to provide relief. Anemia, a condition characterized by a deficiency of red blood cells or hemoglobin in the blood, might seem unrelated to colon cancer. However, it can be a silent but significant warning sign indicating internal bleeding caused by a tumor in the colon. When a tumor grows in the colon, it can sometimes bleed, often in small, undetectable amounts. Over time, this chronic blood loss can lead to iron deficiency anemia, as iron is essential for the production of hemoglobin, the protein in red blood cells that carries oxygen throughout the body. If you've been experiencing symptoms like fatigue, weakness, shortness of breath, pale skin, dizziness, and cold hands and feet, it's essential to consult your doctor. A simple blood test can determine if you have anemia and if further testing, such as a colonoscopy, is necessary to rule out colon cancer. Our stomachs are constantly communicating with us, sending signals about hunger, fullness, and sometimes pain. While occasional abdominal pain is normal, persistent or recurring pain, especially if it's accompanied by other symptoms, should never be ignored. It could be a sign of something more serious, including colon cancer. When a tumor grows in the colon, it can irritate the surrounding tissues, causing pain or discomfort in the abdomen. This pain might be crampy, achy, or sharp, and it can vary in intensity and location. In addition to pain, a tumor in the colon can also cause other digestive disturbances, such as bloating, gas, nausea, vomiting, and changes in bowel habits. If you're experiencing any of these symptoms, it's crucial to consult your doctor to determine the underlying cause. Don't dismiss abdominal pain as just gas or something I ate. Persistent pain requires medical attention. While many people dream of effortless weight loss, unexplained weight loss, especially if it's significant or rapid, is never a good sign. It's often a red flag that something is amiss in the body, and it could be a symptom of colon cancer. Cancer cells are like greedy invaders, consuming the body's energy and nutrients to fuel their own growth. This can lead to unintended weight loss, even if your appetite and eating habits haven't changed. If you've lost a significant amount of weight, 5% or more of your body weight, within 6 months to a year without trying, it's crucial to consult your doctor. They'll conduct a thorough evaluation to determine the underlying cause, which might involve blood tests, imaging scans, or other diagnostic procedures. Don't ignore this symptom or attribute it to aging or stress. Early detection is crucial when it comes to cancer treatment, and addressing unexplained weight loss promptly can make a significant difference in the outcome. We've all experienced nausea at some point, whether it's from motion sickness, a stomach bug, or simply eating something that didn't agree with us. While nausea is usually temporary and resolves on its own, persistent or recurring nausea, especially if it's accompanied by other symptoms, should never be ignored. It could be a sign of a more serious underlying condition, including colon cancer. When a tumor grows in the colon, it can obstruct the normal flow of food and waste through the digestive system. This blockage can lead to a buildup of pressure, triggering nausea and vomiting. In addition to nausea, a tumor in the colon can also cause other digestive symptoms, such as abdominal pain, bloating, constipation, diarrhea, and a feeling of fullness or discomfort after eating. If you're experiencing any of these symptoms, it's important to consult your doctor to determine the underlying cause. Don't dismiss nausea as just a stomach bug or something like that. Persistent or recurring nausea requires medical attention. We've covered 8 potential warning signs of colon cancer. It's important to remember that experiencing one or more of these symptoms doesn't necessarily mean you have cancer. However, it's crucial to be proactive about your health and consult your doctor if you notice any changes in your body. Colon cancer is classified into stages based on the extent of the tumor's growth and spread. Stage 0 is the earliest stage, where abnormal cells are found in the lining of the colon but haven't spread beyond the inner layer. As the stages progress, the cancer spreads further, reaching nearby lymph nodes in stage 3 and distant organs in stage 4. If you experience any of the symptoms we've discussed or have concerns about your risk of colon cancer, don't hesitate to schedule an appointment with your doctor. Early detection is key when it comes to colon cancer, and seeking medical attention promptly can significantly impact treatment success. If you found this video helpful, please give it a thumbs up, subscribe to our channel, and hit the notification bell so you never miss an update. Stay informed and stay healthy.